Loratadine D is a combination of an antihistamine and a decongestant. The antihistamine provides relief of seasonal allergy symptoms such as watery and itching eyes, runny nose, and sneezing. The decongestant helps relieve a stuffy nose, promotes sinus draining, and improves breathing. It is important to note that this medication is not recommended for use in children under 12 years of age due to the high amount of pseudoephedrine. The recommended daily dosage and the best time to take this medication should be determined by consulting a healthcare professional. To take Loratadine D, simply follow your doctor's instructions and take it by mouth, usually twice daily with a full glass of water. Be sure to swallow the tablets whole and do not crush or chew them to avoid any potential side effects. It's important not to increase your dose or take it more often than directed. Also, avoid taking this medication for several days before allergy testing, as it can affect the test results. If you have any concerns or questions, consult your doctor or pharmacist for more information. Some common side effects of Loratadine D may include dry mouth, mild stomach upset, trouble sleeping, dizziness, headache, nervousness, loss of appetite, or thirst. However, many people using this medication do not experience serious side effects. If you do experience serious side effects such as fast/irregular heartbeat, uncontrolled shaking or tremor, mental/mood changes, difficulty urinating, or seizures, it is important to contact your doctor right away. Additionally, seek medical help immediately if you notice symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. It's important to remember that this is not a complete list of possible side effects, so if you notice any other effects, it's best to contact your doctor or pharmacist. As for the best time to take this medication, it's recommended to follow your doctor's instructions, and if you have any concerns about the dosage or timing, don't hesitate to discuss them with your healthcare provider. Before taking Loratadine with pseudoephedrine, it's important to talk to your doctor or pharmacist if you have any allergies to similar medications or if you have had serious side effects from other decongestants. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's best to discuss this with your pharmacist. It's important to also inform your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, problems with urination, high blood pressure, diabetes, heart problems, thyroid issues, or glaucoma. This medication may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid driving or using machinery until you know how this medication affects you. Limiting alcohol consumption is also recommended, and it's important to talk to your doctor if you are using marijuana. For older adults, they may be more sensitive to the side effects of this medication, which could include fast or irregular heartbeat, dizziness, problems with urination, trouble sleeping, or confusion. It's important to be aware that dizziness, trouble sleeping, and confusion can increase the risk of falling. During pregnancy, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Additionally, this medication can pass into breast milk, so it's essential to consult your doctor before breastfeeding. When taking Loratadine D, it's important to be aware of potential drug interactions. This means that other medications you may be taking could affect how Loratadine D works or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking MAO inhibitors, isocarboxazid, linezolid, metaxalone, methylene blue, moclobamide, phenelzine, procarbazine, razagiline, sulfinamide, selegiline, trenylcypromine, while using Loratadine D, as it may cause a serious and possibly fatal drug interaction. Most MAO inhibitors should also not be taken for 2 weeks before treatment with this medication. It's important to ask your doctor when to start or stop taking this medication. Be sure to check the labels on all your medicines, as they may contain similar ingredients that could interact with Loratadine D. It's important to ask your pharmacist about using those products safely. Additionally, avoid using medications containing desloratadine while taking Loratadine D, as they are very similar and should not be used together. Lastly, be aware that this medication may interfere with certain lab tests, potentially causing false results. It's important to make sure that lab personnel and all your doctors are aware that you are using this drug. If someone has taken too much Loratadine D and is experiencing serious symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact your local poison control center right away. In the U.S., you can reach the Poison Control Center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include irregular or unusually slow or fast heartbeat, unusual nervousness or excitement, and seizures. It's crucial to seek medical help if you suspect an overdose of Loratadine D. This medication should not be shared with others. It is used to relieve symptoms of hay fever and other allergies. The recommended daily dosage for adults and children 6 years and older is 10 mg once a day. It can be taken with or without food. It is best to take it at the same time each day. If you forget to take a dose of Loratadine D, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take 2 doses at once to make up for the missed one. When it comes to Loratadine D, it's important to store it at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to getting rid of any unused or expired medication, it's best to consult your pharmacist or local waste disposal company for the proper way to dispose of it. Avoid flushing it down the toilet or pouring it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.